class. We'll talk about the definition, type, problems, concepts or framework, prevention and control. This class is basically to introduce about the malnutrition. Then we'll go to the important malnutrition like protein, energy, vitamin, iodine, iron. This will now after onward we'll go to the specific malnutritions, their problem, their what would be the solution, especially from the perspective of the population health. We'll be mainly focusing on the perspective of the population health. Individually, it will be taught whenever you will be in third year or fourth year how to treat the individuals for the malnutrition, like during your critical years. Okay. So definitions, as you have also said, and sorry. So definition is that it's referred to the deficiency, excess or imbalance in personal intake of energy or nutrients. So it could be excess, it could be deficiency and imbalance between the intake and expenditures. So it covers the range of short-term, long-term conditions that results in the physiological impairment caused by the lack of or excess of nutrient in the body. So it could be short-term effect or long-term effect. So malnutrition is excess or deficiency, as well as the short-term and long-term. Both will be covered. Covers short-term and long-term condition will be covered under the malnutrition. So I think that there shouldn't be any confusion on this or any problem. And they are broadly categorized into the three groups. One is undernutrition, like underweight, wasting, stunting, or deficiency of the like especially for the protein energy malnutrition. Another is overnutrition or over related disease like overweight, obesity, or nutrition related non-communicable disease. Basically they are related with the overnutrition. And third group, it is broadly categorized into micronutrient related malnutrition. One way you could do is like undernutrition and overnutrition only, like vitamin A deficiency, iron deficiency, or everything comes under the undernutrition part also. That way also you could do. And but currently they have divided micronutrients separately, because if you make a big umbrella terms, then those things might be miss in like focusing on the especially the protein energy malnutrition problem. So micronutrient deficiency might be missed. So they have categorized it separately, micronutrient related over or undernutrition, under the micronutrients related malnutrition, and other is a undernutrient or overnutrients problem. Okay. And problem, this one thing regarding the malnutrition and current situation is discussion is going on that now this pandemic will going to increase the malnutrition problem. They are discussing, and let's discuss about that also. Why do you think this pandemic is going to increase? Anyone? Preksha? Joshi 60. How this current COVID-19 is going to affect the nutrition problem? Sandesh Koirala, 62. Anyone can speak. Don't make me to ask. Sahadat, you want to tell 69, please? Sabina, 13.
Yes, sir. Like production rate has been decreased, and maybe economic crisis is increasing, and those working group who are basically working on daily wages, they won't be able to work much and earn for living, and like poverty underprivileged group will basically they will more be affected by malnutrition. So main focus will be in production decreasing and economically less economic activities.
Yeah, that's nicely you have said that. Especially the malnutrition problem is mainly in the lower startup people, and those are economically vulnerable people. And with this pandemic and all the lockdown, mostly affect will be the this under this different strata. The lower strata people will be mainly affected by disease itself, as well as the impact of the our measures like lockdown measures. They will impact on that, so that their access to food will be hampered. Like if you see the any news channel or like that, like if you see the Indian channel or news, also those are migrant labor or those who have come migrant labor, you might have heard the news, some people have died on the way traveling, and it's not necessary, it might be due to the disease itself, rather than maybe they might not have the food for a long day, 3 days, 2 days. So because of that, people have died. So mainly one way is directly affect is that they are economic, and another is that if someone people who could earn died in the family, like those who are migrant labor, means they are the bread owner of that family, like someone who has gone out of the home to work to the dead, and if they died, then again the cycle will be again the whole family will be affected. In that way also will be affected. And productions, yeah, the agriculture production is not going to affect it that much of this, but industrial and other production has been decreased. But definitely the economic impact that will, or recession that we are going to have in the future, that's again going to affect, and also affect indirectly way through the program. Like certain program are there which is mainly targeted to the very ultra poor or very poor peoples. Now if whole country or whole world go in the recession, then the donor won't be there who could be support there. Like all the if country go in recession, then they cannot give you the money for the programs, and those all program will be affected. One way is that. Another indirect way is the COVID disease will also affect the health program also. Like if you see the news, then a lot of children has missed the vaccinations, means they are prone for the infections. These children are prone for this vaccine preventable disease. Lot of nutrition-based program hasn't been, because all the resources is diverted to the COVID. All the healthcare workers are now working against the prevention or control of the COVID program. Means all the nutrition specific program will be affected. So then, so that's how also going to affect the whole the malnutrition programs. Okay, keep that in mind, and we'll discuss the again during the concept of or conceptual framework, like how all these things could be related. So this is the problem is with them, like how much people, like 7 billion plus people are there, but almost 2 billion adults are overweight, and half billion people are underweight. So this is the problem. Like country Nepal is double burden of nutrition problem. Like in the city or in Nepal, not only, like in the whole world, probably we are going to the double burden. Like especially the third world country like us, Nepal or other third world country, the obesity is increasing, and undernutrition is always there in the there. And among the children under the 5 weight, 52 million children are wasted, 17 million are severely wasted, and 155 million are stunted. That means a lot of people are that, and almost 50% of the death under the 5 years are related with the undernutrition. It's not like undernutrition caused the disease. The cause of disease might not be direct cause, but it could be indirect, as I was talking with you also. If child is undernutrition, means their immunity power will be low, means they are very prone for the infections, and that might have resulted into the death. So that's how in that way also could be related. So 50% of the child could be related with the undernutrition. So this is the general problem statement. If we be specific about the Nepal, though we have improved in the last 20 years, like you can see from the number also, like the number of the stunted is also now decreased to 36 from 57. Similarly, underweight has come down from the 42 to 27. Similarly, wasted also almost decrease, almost constant, but it's decreased from 15% to now around 10 to 11 percentage for the children less than 5 years. This is a trend of nutrition status in Nepal. So it is improving, but it's a high, like 1/3 of the children less than 5 years have got the malnutrition problem. Means 36 is more than 1/3. It's a chronic malnutrition problem actually, and underweight and wasted are the acute one. So we'll discuss. Stunted means like पुड्को हुनु भन्छ क्या नेपालीमा चाहिँ, हैन? And low weight for height. Sorry, height for age. Stunted means त्यो एजको लागि चाहिँ जति हुनुपर्ने, and it represented the chronic malnutrition. Stunted means. Okay, thank you Sabina for questions. Stunted means पुड्को हुनु भन्छ नि, हैन? Low weight, height for age, for that particular age, if height is required is 4.5 feet or 135 centimeters, and if child is only the 110 centimeters, means that is stunted. Okay, we'll discuss this a little bit in the protein energy malnutrition also, and that's why I want you to go through the assessment, nutritional assessment part also. Please go through that. It's a very important topic practically also. It's very required, especially for the pediatric. So please go through those growth chart and have a concept about that, like how calculation is done and these things. Practically also, you may ask during the exam for the growth chart and just interpret that. But in addition to that, exam point of view, in addition to that, practically also is very important. Okay. So this is the problem statement of worldwide and that. Now we'll discuss about the concepts or framework for the malnutrition. This graph is trying to show that how malnutrition is like what are the determinants for the malnutrition. You might have read the determinants of health. So we'll be reading the determinants of the particular problem, one specific problem, it's malnutrition. And if you see this graph, there are the manifestation is the problem, that's manifestation is malnutrition. And there is a whole list of causes, like immediate cause means immediately that will affect that, and underlying cause for the particular disease, and basic cause. So whenever you think of a disease, like sometimes we might be thinking, if you think individuals, we might be thinking from the point of the immediate cause, like somebody has got diarrhea and now develop the malnutrition. So, okay, we'll focus, okay, this is the diarrhea and causing the malnutrition. But you have to think beyond that also. Why the child is having the diarrhea? Or why? What could be the reasons? Maybe sanitation is poor. Maybe they can't afford for the economic is poor, so that they can't afford for the good sanitations. So all these things also matters. Or so somebody had got an inadequate intake. Why the child is not taking adequately? Because the family is very poor, so that's why they are not being affected. So there will be underlying cause of that, and that will be always affected by the basic cause. So this figure is trying to show that like disease could be the immediate cause or inadequate dietary intake could be the immediate, that might result in the malnutrition. But this is also affected by the inadequate access to the food or inadequate care of the children, which could directly affect the malnutrition as well as indirectly through the inadequate care of children and women might result into the disease and cause the malnutrition. Inadequate care and access to the children might result to the inadequate dietary intake, like mother doesn't have knowledge and she's not giving the appropriate food, so might result into the malnutrition. So that's how, or directly also like cause to the malnutrition. Also the insufficient health service or unhealthy environment like sanitation and all these things are poor, or they don't have the good access to the healthcare center. That's why they can't get the vaccines, or if you think of the current situation of the pandemic, it may affect that also. They cannot get the vaccines and that, and also access to the food at these levels. But this pandemic will come with the basic cause on that, like, so that these things, immediate underlying cause could be affected and they can result into the malnutrition through the inadequate dietary intake and malnutrition. So basic cause is all the resources like human, economic or organization resources also, or inadequate education, which might affect the care and also affect ultimately to the malnutrition. And these all are affected by the political or ideological factors, how the politics or understanding or importance is given. These all resources and human, economic, organization resources mobilization will affected by these ones, and that is in turn will affected by the economic structure also of the country. That will affect. So malnutrition is that the child, whoever comes to your clinic, there will be the series of cause, and you have to think that way also, especially if you are in the policy making. Then don't think that only focus only on the immediate. Okay, the child has a diarrhea. Okay, treat the diarrhea. Give the ORS and manage that. Okay, that's not going to do it well. You have to go to the underlying cause. Why the child is having diarrhea? What could be the cause of the cause or basic cause that is causing? So if you try to address whole things, then you will be addressing the problem. Like if you see the or read the critical analysis of the UNICEF program like GOVI-FFF, that means growth monitoring, ORS, breastfeeding, immunizations, or female fertility, females educations or fertility. These are the major programs. If you see in our government programs, they all are related, like growth monitoring, ORS distribution, breastfeeding, immunization. This comes under this specific primary healthcare approach. And the main problem of this is that it's not addressing the cause of the cause. It's not addressing the cause, underlying cause, only the general or immediate cause they are addressing, and underlying cause are especially the economic structures or environment, and all these things should also be addressed. That's why this concept of sustainable development goals are there. So if you go to this history about how the sustainable development comes from the primary healthcare approach, then health for all, which was not achieved, and then came to the Millennium Development Goals. And if you read the critique of the Millennium Development Goal and then Sustainable Development Goal, and then now it's considered as a better one. Okay, so you have to think that way also. And the vicious cycles of the malnutrition that I was also highlighting previously also. If child is malnourished, his immunity will be less, and he will the one who will have disease, and it may direct disease can cause the, I haven't shown the here, but it may directly disease will result in the malnutrition also. Disease means that will decrease the productivity, and that means productivity decrease means countrywide development will be decreased, resulting to the lot of poverty, and again affect the malnutrition. So this way also. So malnutrition means decreased development, child development, or decrease in growth. Means ultimately that will affect the productivity, and again the cycle switch. So this is how the vicious cycles will be there. That's why addressing the malnutrition, it's not only addressing the immediate child health or health of the children. So it's about the affecting or addressing the whole country productivity and ultimately the economic and all these things. If the child become healthy, means your population's health will be improved, or the workforce child who is going to be adult or adolescent adult later will be healthy one, and then that will affect the productivity and the workforce of the nations and economic development related on that. So the malnutrition is not only related with the immediate health of the individuals only. Okay, and there is a vicious cycles of these malnutritions. And another concept is that the intergeneration cycle, it's not only the malnutrition is going to affect the immediate health of that child, it's going to affect the next generations also. Like this is showing, like if there is a low birth weight child, I mean the child will be stunted in the future. The stunted child means stunted adolescence, and that means the adolescents who or the women who are going for the reproductive age will be malnourished, and that whenever they get pregnant, then they will gain a low weight, and that will affect the next child who is coming into the future will be also the low birth weight. So this malnutrition cycle is going on generation to generation. It's not that it's only affect the current generation, current economic, but next generation is also it's going to affect. So, and there are other factors also. It's not that the low birth weight is only there, but there are the other contributing factors like inadequate weaning, frequent infections, inadequate food and health care, and child wasted result of these, and result the chronic malnutrition, and which will reduce the mental capacity, and as previously also said, shown that reduced growth and development will decrease the productivity. There is one, and this will be more aggravated by the inadequate food and health care, and resulted in the adolescent stunted, and again that will go to that will affect the reproductive age group, and it's not only the outcome of the baby, but also in terms of the mortality rate also will be there. And if there will be malnourished, then our older people will be also malnourished, and which will reduce the capacity to take care of child. And so in this way, the malnutrition is not affecting the current child, it's going to affect the next generation also. That's why this malnutrition need to be addressed for the for holistic solutions also. Okay, this is the about the concept of the malnutrition. Now I'll discuss on the prevention and control. Before going that, any questions or any comment, any confusion? Amiksha. Sonali Gupta, 67. With this, now can you really, yeah, please, my question is now think from the pandemic again, the same question I'm asking, how pandemic is going to affect the malnutrition? So with this picture, can you say something? With this conceptual framework? Sonali?
Yes, sir. It might be affecting the pregnant woman. Sometimes in pandemic, there is lack or deficient in nutrition when a woman take for their. I don't know, sir.
Okay, you are going good. Like you are focusing on this part, like inadequate care and children means the pandemic will divert whole the resources, financial, human resources, and there are a lot of story are also coming, like people are reluctant to take the pregnant woman or pregnant woman for the delivery and all these things because of the fear of pandemic, and also the lot of maternal mortality are there. You can imagine, like there was a first case in Nepal. She died, which was unfortunately in our hospital. Now she delivered the baby, but mother is died. So whole child care and development will be affected, and so the child might have inadequate dietary intake or risk for the disease and malnutrition. One minute. Good. Anything? Anyone like to add? Manish 77. How pandemic is going to affect or result into the increase in malnutrition? Jenisa 84.
This pandemic is affecting the health services as well, because we are not going to the hospital,
Okay, good.
and it leads to the disease, which ultimately leads to the malnutrition.
That's
And
what is it?
like we said, we are not accessible to the food. I mean, the poor people are not having good food, which also leads to the malnutrition.
Yes, you have highlighted 2 point. One is health services is going to affect it, and that's means other disease or care will be affected and ultimately malnutrition. Another is the economic part will be affected. Economic part means inadequate access to food and intake and ultimately the malnutrition. Okay. Any other example? Avinay Upadhyay. Sushant Adhikari.
So economic structure will be affected, and it will affect the approachability to the food supplies.
Okay, good. Same thing, like economic whole structure will be affected, and through this pathway also the access and intake and can lead to the one. And also the political ideological factors will be also like political factors will be also in the play. Like the pandemic means whole the political will be diverted to the or whole the political discourse will be diverted to the handling the pandemic. But there might be this chronic problem, or that this malnutrition has been the chronic problem for us. So these things won't come into the in the program also, or under their radar. It will be neglected. So that's why also it's going to affect it. And another part, we should not forget about the human resource loss also. Because of the pandemic, we are going to lose the somebody. It's not that there has been more than lakhs as people has been died. I think how many lakhs people has 2 or 3, like millions of people, lakhs of people. I think some 2 or 3 lakhs people has already died. Means among them will be the human resources who, like lot of human resources will be lost, who could work in this nutrition program, or it could be the healthcare worker also will lose. Means that's also the great loss for the country, and all the program will be affected. And that's how the also this from the perspective of the human resources also, it will affect whole 3 underlying cause and will affect malnutrition. So think that way also. Okay. Now, how we could prevent or control the malnutrition? How we could do that? Karan Jha? Sri Suna 51.
trying to become self-sufficient, self-cultivation for the food at the most possible level.
Okay. Yes, Jagmohan.
Sir, I want to add that the cause of malnutrition can be also other than economic and less of healthcare service. There could be a social anxiety and fear, because if we wanted to provide some food and anything to the less deprived children or family, they are not accepting at this time, because they are just fearing it out at this pandemic. So prevention and control could compose of the things that letting them know what it takes to be a corona. You should know that how there should be a corona testing thing. They should know at least basic that corona is not submitting through it, because I myself have tried to distribute food, but they are hesitant to take it. They think that it is just transferring through hand touch and all.
Like this good one means the inadequate
Social-
education. The component
And
that you are focusing is the like lack of education or
Lack of education.
understanding about the disease itself is affecting
Mm.
that how
The-
all the program will be implemented, and that might also lead to the malnutrition. So that's a one.
Yeah.
Good one.
Yes.
Okay.
Thank you, sir.
And prevention and control. Now we won't be discussing specific to the this pandemic situation. We'll talk the broad about broad about the malnutrition broad program and prevention and control program. But you have to think if you think particularly related with the current situation, then you will understand more. That's I want you to think that way also. Don't only think try to relate the things that is current problem or the knowledge you have got. This is how you do the learning. Learning is adding the brick by brick in. I have talked to you about the first class, like learning is done brick by brick, adding the one brick extra and another. You have got now, everyone is thinking about the pandemic. Now, if you correlate this malnutrition pandemic and try to understand the malnutrition from the lens of the pandemic also, then you will understand both pandemic as well as the malnutrition. Okay. So prevention control, we'll talk about the broad and go and do the brainstorming, like, okay, how we could, in these pandemic situations, also prevent the malnutrition that's going to be, will have, it might not be immediately, but in the long run, maybe 1 year, 2 year, a decade down, that we'll have the malnutrition problem. So to reduce the impact of these malnutritions, you have to think the program that way, okay? So this is a diagram showing that what are the different program could be also. That as we discuss about in the conceptual framework, that immediate cause or underlying cause or cause of the cause or basic cause. So intervention also, we have to think that way also. Like it's not intervention should be at the different level, not only the immediate level also. So if we think this is the our target, optimal fetal or child nutrition and development, which will definitely benefit during the life course, like decrease maternal morbidity and mortality of childhood, increase social and development, increase school performance, adult stature will be high, obesity will decrease, work capacity will be increased, and ultimately the benefit will be the whole country and will be benefited. This is the outcome, but our target is optimal fetal and child nutrition and development. Then what should be our this immediate one? This blue one is the immediate, addressing the immediate causes like breastfeeding, nutrition, rich food or routine, and feeding or caregiving practice or parenting stimulations, low burden of infectious disease, reducing the burden of disease. So program are the nutrition specific programs or interventions. A few examples are that for addressing all these things, because these, if we breastfeed the child or nutrition rich food, if we could supply the nutrition food and make a routine of the choosing the healthy food, then optimally child and nutrition will develop. Similarly, feeding or caregiving practice, like if we identify there is a problem, feeding caregiving practice and improve that or add on that, then ultimately that will be affected. And ultimately, if you decrease the disease burden, and this will affect the child and nutrition. How we could do, what are the programs, like these are the example, like adolescent health or preconception nutrition. One could be that. Another is a maternal dietary supplement, so that low birth weight could be decreases. Micronutrient supplementations or fortifications. These are the addressing the immediate cause. Like if there is no adequate supply of the food, then you could at least supply the micronutrients or fortifications, like iodine deficiency, you can fortify the salt and provide to the community. So that's one. Another is a breastfeeding or complementary feeding program, targeting that why exclusive breastfeeding should be done, how it should be done, what are the how complementary feeding could be improved, or what are the faulty practices to identify and address those things could be done. And there is a dietary supplement for the children, like if the family cannot afford the food, then could provide the dietary supplement program, like pulpy nut programs are there, so that this the child will grow optimally, and that's our target. So child growth could be the optimum, or development could be the optimum. Another program could be the dietary diversifications programs. That means the focusing on all the nutrient food, not only the or advocating for the balanced diet. Feeding behavioral stimulation program, treatment of severe acute malnutrition. It's also come to, it's not only the prevention part, but also treatment. Someone child has a severe acute malnutrition, then program should be there to treat that program. And disease and management and prevention, nutrition intervention, and in emergency. So that means the pandemic situations also demand the nutrition emergency, because this is the emergency situation. So there should be programs for nutrition intervention targeting for during the specific. Last time also during the earthquake, there was a program. So similarly for the pandemic also there should be, so that child development won't be affected. So this is about the nutrition specific intervention, and there could be the nutrition sensitive, means that is addressing the underlying cause, like food security, economic access, use of food, feeding or caregiving resources like maternal, household or community levels, at the community level, or access to use of health services or safe hygiene environment. So these are the addressing the underlying cause. So what could be the program? Example, like agricultural food security program, social safety net program, early child development program, maternal mental health program, women's empowerment program, child protection, classroom education, water and sanitation, health and family planning services. So these are nutrition sensitive program, means targeting the underlying cause, so that this background or this platform will address the immediate cause also, and ultimately our target is the optimal fetal childhood. So, and this is also addressing the cause of the cause, this building the enabling environment, like program like advocacy, the horizontal or vertical coordinations, or interdepartment coordination, accountability or legislation, rules and regulation, or accountability for the program that has been implemented, leadership program, capacity investment, domestic research mobilization. So this is the addressing the cause of the cause, or the basic cause of the program. So okay, so this is the conceptual framework, like for the program, whenever you have to design a program. So it shouldn't be the immediate one. If someone has the diarrhea, not only treat the diarrhea. If you are policy maker, then you have to think, okay, how to address the other immediate cause, as well as the underlying cause, as well as the cause of the cause, or basic cause. So this is how you make a framework. Okay. So now think, you want to design the program to minimize the impact of the pandemic on having a malnutrition in the future, then if you have to think, then think that this way, okay, from every level, how you could design the program, okay? And probably this is the last slide, and this is also showing this similar way, the framework on addressing from the adolescent to the pregnancy, neonate, and infant and child program. This cycle of this intergeneration cycle could be break the cycle that. And the example are like preconception care, like family planning, delay age, pregnancy. Another is for pregnancy, like folic acid supplementations, micronutrient suppletion, calcium supplement, balance energy program, supplement iron or plus folate program. Similar for neonate, like delay cord clapping, early initiation of breastfeeding, vitamin K, neonatal kangaroo mother care. For infant and children, like explosive breastfeeding, complementary breastfeeding, vitamin A supplementations. Similar disease prevention treatment targeted to the pregnancy, like malaria prevention, maternal deworming for the child, like management of SAM, MAM, is that so that it decrease maternal or child morbidity and mortality or improve growth and development, and ultimately the economic development or capacity improvement, work capacity improvement, and product and economic development. So this is the another way of presenting the same thing. Like previously we presented in terms of the nutrition specific or nutrition sensitive programs targeting the immediate cause or language. But you could think in a different way also, that in the different life course, like from childhood to adolescent to pregnancy to the neonate, what the specific program that we could frame that, okay, this. And this is the delivery platform, like community delivery platform, integrated management, IMCI, child health day, school-based delivery platform, financial platform, fortification strategy, nutrition emergency. So this way this program or this all the your program could be implemented. Okay. Any questions? This is about the concept of the malnutrition. We have got 9 minutes more. Now I want you to go through the at the very beginning I have asked you to plot the growth and development or this chart, this WHO chart for the anyone in your family or in your neighbor or your relative child less than 5 years. Okay, go and plot that. And if you have got any question, please ask me. Okay. And another part at the end, I want you to go and think like how you could prevent the malnutrition or reduce the impact of this pandemic for the developing the malnutrition in the future. How you could do that. So just have an idea of that. Okay. Any question?